Exploring health insurance coverage. New technology in health insurance coverage is exploring ways to use innovative technologies and approaches to improve medical care delivery, reduce costs, and ultimately improve health outcomes. Examples of new technologies include telemedicine, telehealth, mobile health applications, electronic health records, and predictive models. Mobile health apps enable insured patients to track and monitor their personal health data from their smartphones. Electronic health records are creating an interconnectedness between health insurance companies, providers, and patients, allowing for better communication. Predictive modeling is being used to focus counseling services, initially for members who have chronic conditions, and to identify populations that may benefit from certain treatments. By leveraging new technologies and approaches, health insurance companies are enabling more efficient, cost-effective benefits delivery, better connecting insurers, providers, and members. Understanding health insurance basics. Health insurance is a type of coverage that pays for medical and surgical expenses incurred by the insured. It also helps pay for any related services or benefits such as hospital stays, intensive care, ambulances, and other forms of medical care. When a person or their family is purchasing health insurance, they need to understand what the different levels. Strategies for choosing health insurance. Choosing health insurance can be a complicated process, but understanding the different policy options available can help individuals make an informed decision that fits their needs. Consumers should read the policy documents carefully to assess the level of coverage and associated costs. Additionally, they should compare policy options from different providers to find the plan that offers the most value and benefits to fit the budget. Exploring different types of health insurance. Health insurance can be divided into different types, including individual health insurance plans, family health insurance plans, group health insurance plans, and government-sponsored insurance. Each type of plan has its own benefits, drawbacks, and coverage limitations. For example, individual health insurance plans may provide more flexibility than group health insurance plans but may also come with higher premiums. Benefits of private health insurance. Private health insurance provides direct access to medical care for the insured. It also helps to cover the cost of inpatient care, preventative services, and specialized treatments. Furthermore, many private health insurance plans provide access to a wide variety of physicians and specialists. Additionally, private health insurance can offer more comprehensive coverage than government-sponsored insurance plans. Comparing coverage options and costs. When shopping for health insurance, it is important to compare different policies to determine which one best meets your needs. When comparing quotes, consumers should look at the different costs that are associated with the plans. Additionally, it is important to read the fine print and look for a plan's specific covered services, co-pays, deductibles, and overall cost. Considering tax implications of health insurance. Health insurance policies and benefits are generally exempt from taxation. However, there may be tax implications associated with specific plans or programs. For instance, ENDSs or other health care savings plans may require contributions from pre-tax earnings, which can affect income taxes. Additionally, some tax credits or subsidies may be distributed through specific health care plans and programs. Exploring government programs for health insurance. Government programs such as Medicaid and Medicare are available to low-income individuals as well as the elderly and disabled. Government programs such as Medicaid and Medicare are available to low-income individuals as well as the elderly and disabled. Depending on an individual's eligibility, these programs can help to cover or offset the cost of health care services. Additionally, there may be additional programs and services available depending on the state or country the individual resides in. Navigating the appeals process. If an insurance claim is denied, it may be possible to submit an appeal and request a review of the decision. Depending on the health insurance provider or program, an appeal may require the completion of specific forms, submission of additional documentation, and the involvement of an attorney. Finding the right health insurance plan for you. Finding the right health insurance plan can be a challenge, especially when there are so many different types of plans and policies available. To maximize the value and benefits of a health insurance policy, individuals should assess their needs and compare different plans, considering the cost and coverage options. Additionally, it is important to read the policy documents to ensure the plan is the best fit for the individual. Determining your health insurance needs. Before comparing different health insurance plans, it is important to assess your needs to determine what type of coverage is needed. The individual's income, the coverage cost, the type of provider being used, and the type of medical care that will be needed all factor into determining the best health insurance plan for an individual. Evaluating your health insurance provider. In order to ensure the highest quality of service, it is important to evaluate a health insurance provider. This includes researching customer reviews, pricing, customer service, and the provider's online presence. Additionally, it is important to look at the extent of coverage offered and check if that coverage is applicable to the individual's needs. Planning for the future with health insurance. It is important to plan ahead when it comes to health insurance. Consumers should consider if the policy needs to be changed or adjusted in the future, such as if an individual is planning to move to a different part of the country or have children. Additionally, individuals should think about the different types of care they may need in the future, such as dental, vision, or long-term care. How to use health insurance benefits. When using health insurance benefits, understanding how to maximize the system is important. This includes understanding the in-network doctors and providers, the types of care that are covered, and how to use co-pays and deductibles to reduce costs. Additionally, it is important to keep track of medical expenses and statements to ensure the coverage is being used correctly. Staying informed about health insurance laws and regulations. Health insurance laws and regulations change and evolve often, so it is important for individuals to stay informed. This includes understanding changes to health insurance policy requirements across different states and at the federal level, as well as searching for updates on health insurance products and plans. Additionally, staying up to date on any changes to an individual's health insurance policy is important.